ready? Okay. Good afternoon, and welcome to Berks Community Health Center at Oakbrook. On behalf of the Board of Directors and my team, I extend a warm welcome to the federal agencies who are with us today to recognize President Biden's National Month of Action. U.S. Housing and Urban Development, U.S. Department of Health and Human Services, Health Resources and Services Administration. I also warmly welcome Senator Bob Casey Jr.'s office, U.S. Representatives Chrissy Houlihan's office, Reading Mayor Eddie Moran, Reading Housing Authority, Trey Stacy, and United Way of Berks County. And welcome to the rest of our friends who are present. We are honored to have you all here today. Berks Community Health Center is a federally qualified health center founded in 2012. Our mission is to provide high-quality health care to anyone regardless of their ability to pay. In 9 short years, we have grown to 4 locations throughout the city, serving over 14,000 patients. This location, Oakbrook, is located across the street from one of Reading Housing Authority's communities to increase access to health care to their clients. As a truly community-based organization, we collaborate with several community partners to address complex social problems. If you arrived here earlier this morning, you would have seen the local food bank helping harvest, distributing food to in our parking lot to community members in need. Lunch was also served here today, as it is every Tuesday during the summer, to the children in the Oakbrook housing neighborhood participating in the Books of Bikes program, a partnership between United Way's Ready, Set, Read, the Berks Community Health Center, Customers Bank, the Reading School District, and the Reading Housing Authority. It is designed to provide literacy activities to children in the Oakbrook housing neighborhood in an effort to reduce summer learning loss. United Way of Berks County has provided BCHC funding the past 2 years for a staff member to help lead a collective impact council to prioritize needs and coordinate collaboration efforts for what Oakbrook residents have identified as their critical issues. It is collaborations like this that help us identify and address social determinants of health to have the greatest impact to our patients. The partnerships being discussed today are vital to helping our communities live healthier lives. Please welcome Jane Miller, Deputy Regional Administrator of HUD Region 3.
Good afternoon, and thank you for joining us. I'm so pleased to be here today to discuss our joint initiative with the Department of Health and Human Services. We are aiming to increase access to COVID-19 prevention and treatment services in underserved and vulnerable communities. Among the households HUD serves in Reading and across the Mid-Atlantic region are the most vulnerable in our society. They're seniors, they're people with disabilities, they're people of color, from households of modest means, and they're people who are experiencing homelessness. The availability of testing and COVID-19 vaccines at federally qualified health centers like Berks Community Health Center can make a very big difference in their lives. The effort is part of a national partnership with HUD Secretary Marcia Fudge and HHS Secretary Javier Barrera, announced on May 5th in Washington, D.C. More than 153 million Americans are now fully vaccinated, according to statistics from the CDC. Several Mid-Atlantic states are leading the way in these efforts. I'm pleased to say Pennsylvania is one of them. To raise our vaccination numbers even higher, we must continue to center our efforts around guiding principles of equity. Through this regional initiative, we will focus on connecting HUD households with any needed support, not just here in Pennsylvania, but across the Mid-Atlantic region, which also includes Delaware, Maryland, Virginia, Washington, D.C., and West Virginia. This support will include registering and scheduling appointments for individuals to get tested and vaccinated for COVID-19, providing culturally sensitive outreach by trusted providers that encourages folks to get the vaccine, and, where needed, to set up vaccine clinics at HUD-supported properties and shelters to help bring vaccine right to people's doors. The undeniable truth is that COVID-19 vaccines are safe, and they save lives. This partnership between HUD and HHS will ensure that HUD clients have equitable access to vaccines. This initiative is about saving lives by expanding access to comprehensive COVID care for those in need. It is about meeting people where they live and about bringing health care home. Every dose we provide serves as an important step in our collective journey through this national crisis. And today marks yet another step toward reaching the end of that journey. Before I introduce our next speaker, I would like to express our thanks to Mary Carbo and the Berks Community Health Center for hosting our visit. The preparation for this, I know, interfered a little in what you do here, but thank you so much. We appreciate certainly all the healthcare providers who have been on the front lines in fighting this pandemic, helping communities get back some sense of normalcy through vaccine efforts. I also want to thank our Health and Human Services partners, Dalton Paxson and Leah Suter. HUD has a proud partnership of working with our federal colleagues around such issues as ending homelessness. Thank you. And now we are proud to work together on this new effort. When it comes to preventing and ending homelessness, we have tremendous support in Berks County. The leader of the continuum of care for this area is Jack Williams, Executive Director of the Berks Coalition to End Homelessness. And thank you, Jack, for your support and for being here today. I would also like to recognize and thank the Reading Housing Authority Executive Director, Stacy Keppen, and her leadership team, as well as the Housing Authority's Board of Commissioners and the property manager at Oakbrook Homes, Nydia Rivera. We are proud of these extraordinary efforts that have been made by our HUD housing partners over the past year to keep their residents safe from COVID-19, while also ensuring that the residents have the critical resources needed to get through this very difficult time. At the heart of this effort are our HUD-assisted families. And I would like to recognize Tiffany Kelly, President of the Oakbrook Resident Council. Tiffany, she's not here today? Oh, I'm so sorry that she's not able to join us. It's important to be able to hear from the residents, and Tiffany, as the president of the Residents Council, I'm sure would have been able to share with you how very important this clinic, this center is to the residents, but also the vaccine access that they're getting here. So, with that, I would like to now welcome Dalton Paxton to say a few words. He is the Acting Regional Director of the Department of Health and Human Services right here in the Mid-Atlantic region. Thank you. Thank you, everyone.
Okay, good afternoon, everyone. Welcome to a nice, warm summer day in the Mid-Atlantic. I'm Dalton Paxman. I am the Acting Regional Director, but I'm also the Regional Health Administrator for the U.S. Department of Health and Human Services. There are 10 regional offices across the country for HHS, and ours is located here in Philadelphia, but we cover the 6 states of the Mid-Atlantic. And so I do want to thank Jane for welcoming us and being a partner on this initiative. and this initiative is part of President Biden's commitment to an equitable response to COVID-19, and HHS and HUD are working collaboratively through our excellent health centers and housing partners to ensure our nation's underserved communities and those disproportionately affected by COVID-19 are protected. This national partnership between HUD and HHS was announced on May 5th, and it leverages the Health Center COVID-19 vaccine program, which currently provides a direct supply of nearly 800 health centers across the country. This HHS-HUD partnership helps direct community health centers like the Berks Community Health Center, HUD grantees, and others to facilitate broader access to COVID-19 vaccines and testing. And I will say, and I'm going to go off script here, but that we are holding events like this in each of the 10 regions. So there's one event per 10 regions. And for us in the Mid-Atlantic, in the Region 3 regional office, we wanted to have it here in Reading. And I just mentioned that to the mayor, who said, I didn't know that, and therefore I wanted to make sure everyone knows that. We chose this site, one, because of the strength of the Berks Community Health Center, which is fabulous, but more importantly, because we have Oakbrook right across the street, which highlights in a dramatic way the need to be working together, and is talking to the leadership for public housing, for the community health center, that they are working together not only on COVID-19 vaccine, which is a priority, but they're also working together to improve the health of this community. And this is something that President Biden has strongly wanted to have an equitable distribution of the COVID-19 vaccine. But he also wants us to achieve health equity. And it's these kinds of partnerships which is so dramatically demonstrated here that will help us in reducing health disparities to achieve health equity. Okay, let me go back on script, what I'm allowed to say. So this joint initiative encourages community health centers to establish or further expand existing partnerships with local HUD grantees and program participants like the Reading Housing Authority, including single-family, multifamily housing managers, public housing authorities, continuum care, and homeless providers. Our nation's health centers have played an essential role in achieving the vaccination goal President Biden has set for this country. From what I understand, over 12.7 million vaccines have been administered through our healthcare program, our health center program. And I'm so glad that Leah Suter, our HRSA regional administrator, is here to explain the work of the community health centers. This partnership is part of the larger HHS effort known as the We Can Do This initiative, a COVID-19 national public education campaign to increase public confidence in and uptake of the COVID-19 vaccines while reinforcing basic healthcare measures as social distancing and mask wearing, which is still required for health centers, for public transportation, and for those who are not vaccinated. And I am so pleased, as the father of a recent high school graduate, that my daughter, in the last 2 weeks, has been able to see her friends do the high school senior graduation with her friends without masks, because they are all vaccinated. And that's the promise of the vaccine, is get vaccinated, be with your friends, see your friends. HHS supports We Can Do This as an all-agency approach. Every one of our HHS operating divisions are agencies, from CDC to HRSA to Indian Health Centers, Indian Health Service, and the National Institutes of Health. All of this have made this an all-of-agency approach to make sure that Americans get vaccinated. Investing in reaching people where they are is a critical part of advancing President Biden's vision to create a healthier America. This means highly targeted efforts focused on vulnerable communities alongside mass vaccination efforts into the general public. As the acting regional director and the regional health administrator for the 6 states in the Mid-Atlantic, I am very pleased to say that 5 of our 6 states in the Mid-Atlantic region will reach the President's goal of having 70% vaccinated adults by July 4th, and that includes the Commonwealth of Pennsylvania. We have done very well, but we need to do better to fully protect our families and communities. To quote HHS Secretary Becerra, "We are going to go where you are. We are going to invest in you. Zip codes were never meant to tell you what the status of your health would be." I am so pleased to work together with colleagues like Leah and her HRSA team, our HUD partner Jane Miller and her team, the Berks Community Health Center, the Reading Housing Authority. Mayor Moran, pleasure to meet you. And I say, you can see he's a man of action. I want him protecting me. You can tell that he acts, and I'm very impressed. He's a very good man, and you're lucky to have his leadership. I just want to say that working together, we are going to strive towards ending the COVID threat and creating a more accessible and equitable healthcare system. And at this time, I am pleased to introduce Leah Suter, our HRSA Regional Administrator. Thank you. Leah, please come on.
Good afternoon, everyone. I am so pleased to join you today. And I do want to first thank my federal colleagues, Dalton Paxman, Jane Miller. Also, thank yous to the Berks Community Health Center, the staff, the leadership, the board, notably Mary Cargbo and Debbie Hartranft, who worked so tirelessly to plan and host this event today. And it's also, looking around, you feel the support from the community members, the city, the Housing Authority. It's just a joy to be here. As Dalton mentioned, my name is Leah Suter, and it is my honor to act as HRSA's Regional Administrator. HRSA is the Health Resources and Services Administration, an agency that's part of the Department of Health and Human Services, and HRSA is the federal funder of community health centers like BCHC. On a personal note, I was taking a trip down memory lane and realized that my first opportunity at the podium on behalf of the HRSA Regional Office was almost a decade ago, right here in Reading, at an event to welcome a new CEO to BCHC, Mary Cargbo. So it's just a joy. I've had a chance to visit a few times at different sites of BCHC over the years, and always a pleasure to be here with you in Reading. And I must say, it's remarkable how the health center has grown over those past 9 years. HRSA's mission is to improve health outcomes and achieve health equity through access to quality services, a skilled health workforce, and innovative high-value programs. We see that HRSA mission here in action at BCHC. Continuing to ensure access to vaccinations is critical to stopping the spread of COVID-19. BCHC's longstanding connection with the Reading Housing Authority is a prime example of effective partnership between HUD-supported housing and HRSA-supported health centers. This connection of housing and healthcare is so critical and enhances opportunities to receive preventive care and improves overall health of communities. Our HRSA-funded health centers, which now count nearly 1,400 organizations with around 13,000 locations nationwide, are all community-based and patient-directed. They deliver affordable, accessible, quality, and cost-effective care to nearly 30 million individuals across this country. That is 1 in 11 people in this country that receive their health care at a HRSA-funded health center like BCHC. And given that fact, health centers across the nation play a vital role in supporting the local community response to COVID-19, meeting patients where they are, including vaccination efforts. So I would like to take this opportunity to commend Berks Community Health Center for working tirelessly and creatively to care for the community and to deliver life-saving vaccines to the patients that you serve here in Reading. BCHC is a participant in the HRSA Health Center COVID-19 vaccine program that Dalton referenced, receiving doses, vaccine doses, and have provided thousands of doses to date. BCHC is doing an exemplary job making adaptations to address healthcare needs to some of the most vulnerable populations throughout this pandemic. HRSA looks forward to continuing our work with HUD in this collaboration to ensure that our nation's underserved communities and those disproportionately affected by COVID-19 continue to receive equitable access to the COVID-19 vaccine. In the meantime, may you and your loved ones continue to stay safe and well, and thank you. And now it is my honor to turn over the podium to Mayor Eddie Moran.
Thank you so much for the introduction, and good afternoon to everyone once again for being here today. For me also, it's very personal to be here. I have a long history with this particular building, dating back to before it was Berks Community Health Center, and it was Easter Seal, my son who has special needs, utilized services here. And then, of course, once it was transformed into this amazing state-of-the-art center, I was also allowed to work alongside their staff providing health coverage in my previous employment. So, as mentioned, I am Eddie Moran, mayor here of this great city of Reading. I also want to acknowledge and go off script for a second and acknowledge what amazingly surprised I was to hear that we're only one of a handful within the Mid-Atlantic region.
Only one in the country, in this region.
Only one. Look at that, and that's Reading for you, you know. So now we're not only in the Monopoly game, we are also marked. So it gives me great honor and pleasure to have been selected. So it gives me great pleasure to be with you today to discuss the importance of making sure that every resident in the city of Reading is properly vaccinated. As you are probably aware, Reading is the 5th largest city in the Commonwealth here in PA, and with more than 88,000 residents, reaching herd immunity within our borders is one of my top priorities, to say the least. Increasing access to COVID-19 vaccination in underserved communities not only reflects one of our administration goals, but is also one of the regional area. I'd like to thank HUD. I'd like to thank HRSA, the Berks Community Health Center, and the Reading Housing Authority for this joint venture and for including the city of Reading in this fine effort. While the city has partnered with the PA Department of Health, the PA Department of Aging, Latino Connection, Penn State Health St. Joseph, and Tower Health during the past 6 months to assist with vaccination efforts here in the city of Reading, we have some success in reaching underserved communities, especially the Latino community. And while I've been pleased with our success, we have so much more to do. Youngest residents, school children, and we must not ever forget about our homeless resident who deserve equal outreach efforts. Every person in Reading matters, no matter what part of the city he or she lives in, no matter how much they make, no matter what level of education a person has, they matter. I've been fully vaccinated, thank God, for several months, along with members of my family, including my twin boys, who are 20 years old. And when I heard Mr. Paxman talk about his 20-year-old daughter, his recently graduated daughter, it reminds me that my twin boys are gonna be celebrating the 21st birthday in a couple of weeks. And we have asked all those that are gonna be in attendance to please consider being vaccinated as a show of support into their celebration. I am asking everyone to do the same, to do your part. There's no other way. We have to commit. We have to commit. We must do everything within our power to get as many people as possible vaccinated. That's why I'm asking you to do that. That's why I'm asking you to make a commitment today. Start with your friends. Talk to your family members. Speak with your coworkers. Talk with folks in your supermarket as you pile in the aisle. And of course, those within your church, to say the least. Today, getting vaccinated has been made easier than ever. So, no excuses, folks. So let's continue to building a better Reading, a better state, a better nation. We can do this together. So thank you all so much once again, and I look forward to continue to collaborate and do everything that I can within my power to make sure that we get to a better Reading and to get vaccinated accordingly. So thank you so much once again. Oh, was I supposed to introduce? My apologies. That's what happens when you walk out of the car and they're waiting for you. So, my apologies, but it gives me no better pleasure to introduce the next speaker who I built an incredible respect for and relationship to, Ms. Stacy Keppen, Executive Director of the Reading Housing Authority.
Thank you, Mr. Mayor, and welcome to all of you who are joining our Reading community for the first time. We're so happy that you have selected us for this visit today. We take immense pride at Reading Housing Authority in the quality of our housing communities and are especially proud of our long-standing commitment to service-enriched programming in the areas of health and wellness. Almost 20 years ago, before even Berks Community Health Center was formed, we at Reading Housing Authority launched a wellness program with funding from HUD to address the unmet needs of older adults and persons with disabilities residing in our downtown properties. Fast forward a few years, we were positioned now with data to lobby Berks Community Health Center as our new partner to consider expansion to our largest public housing community, Oakbrook Homes. On behalf of Reading Housing Authority and the 530 households that live next door, I couldn't be more grateful than I am right now to the partnership that we've had for the last 18 months. Home to more than 1,600 children, parents, and grandparents, the safety net of our affordable housing program was a fundamental component for remote learning, for teleworking, and in ensuring housing stability when more than 200 households next door lost jobs. Even more elemental, though, to the marriage between housing and services has been our ability, our internal mandate to serve as conduits to the COVID-19 testing and now vaccination initiative. As we all know, public housing communities have been especially vulnerable to the worst of this public health crisis, and we as a PHA, with a direct line to hundreds of families, have been well positioned to lead the charge in battling both virus and inequity. Our resident services staff have engaged in outreach and education to nearly all 1,600 households agency-wide, making telephone calls and in-person visits when necessary to spread the word on vaccine availability, efficacy, and safety. In the very early days of March, RHA employees registered and helped to staff the first large-scale community-based vaccine program, serving at least 150 residents among the more than 1,000 city residents overall. Our outreach continued through April and May as we hosted a large on-site event at our Glenside homes, facilitated clinics at our youth services agency, and offered smaller catch-up clinics at our senior sites. Because of our existing relationships, we knew of and targeted our most hard-to-reach residents. When faced with vaccine hesitancy, staff made use of personal experience and established trusting relationships between public housing agency and the residents that we serve. Our other essential workers, our maintenance and our property management staff alike, helped by passing flyers and promoting information in their day-to-day work. It has indeed been an all-hands-on-deck calling. The RHA-BCHC relationship is a core component of our service-enriched housing model. From health fairs to topic-specific presentations, food pantries to youth reading programs, from hosting of resident council events to flu shots to senior community service, BCHC is our partner in service to the Reading Housing Authority community. And because of our longstanding relationship, we could be confident in promoting the availability of vaccines at and through Berks Community Health Center, as BCHC has been called upon not just to serve our neighborhoods, but the greater Reading community. We continue to guide residents to their door today. Our staff will continue to work with residents to address barriers like transportation, childcare, and online registrations. There are those within our public housing population served by BCHC that we don't know or can't count among our outreach because they are existing health center patients and therefore did not need our warm handoff. And as we look ahead to the post-pandemic future, it is for this that we will continue to strive, that the health connections that are necessary are made long before that time. We're inordinately grateful to our partnership with Berks Community Health Center in ensuring that residents of Reading Housing Authority have access to the primary and preventative health resources that we all need to live happy, healthy, and fulfilling lives. And with that, I'll turn it back to you, Mary.
Thank you, Stacy. We certainly go back a long way. We're so grateful for our partnership with you, Reading Housing Authority, and look forward to continued collaborations in the future. And we are excited about the joint effort between HUD and HHS to increase access to COVID-19 prevention and treatment services among the underserved communities. We recognize that there are communities in Berks County who are disproportionately affected by COVID, and we are committed to increasing access to testing and vaccines to those communities, as well as educating those hesitant to receiving the vaccine. At the start of the pandemic, COVID-19 services were immediately available at Berks Community Health Center at our 838 Penn Street location. In addition, we soon added a site at a church on 4th Street, who served many of our African American and Hispanic communities around the church. As the demand for testing declined, testing remained available at 838, although we stopped at the church. And we will continue to make this available as far as it's needed. When the vaccine initially became available, BCHC again administered vaccine to health professionals, essential workers, as well as senior citizens at our Rockland location. A few months later, we collaborated with the county in opening a mass vaccination center in the Muhlenberg area, offering free transportation from the city. Again, another collaboration from the Transportation Services BARDA. The demand for vaccines has been declining, so this site is closing at the end of July. But BCHC continues to provide pop-up vaccinations clinics throughout the city, including one here today after this event. And we will continue to address hesitancy through our healthcare providers, our outreach and marketing efforts. Our commitment remains strong, and we thank the agencies represented today for their support and commitment. All community members can visit our website at www.berkschc.org, coronavirus, or you can go to the county site, www.doyourpartberks.com. Again, www.doyourpartberks.com for information on testing and vaccine availability. It was our pleasure to host you all today, and we thank you for attending. At this time, I would like to invite those that want to do the tour to come around and do the tour. It's a much smaller site than other sites, so it won't take that long. But you're more than welcome to come in and see what we do here. Thank you very much for attending.
She just graduated from Pitt this year, and she now is going into nursing.